So we'll start off with Maria Xiao, a second year of undergraduate studies in health sciences at McMaster University. As an avid reader with an interest in creative writing, Maria spent her time in quarantine writing her first book with the Antarctic Institute on COVID-19. She hopes to explore her writing interests further as she pursues a career in medicine. So here she is with the role of robotics in COVID-19.
Thank you for the introduction, Zach. So, hi everyone, my name is Maria, and today I'm going to share a little bit with you what I learned while writing the book just over the past month. So, over the past month, I had the pleasure to work on this project with two other wonderful writers as a part of the Antarctic Institute, writing a book on the details of COVID-19 and the role which robots and robotics play. So at first glance, this topic took me by surprise because personally, I didn't know much about it and I didn't know how much information there is about the topic. But upon further research, it was very interesting to see how much robotics actually can play a role and how much potential there is for artificial intelligence as a whole to help with the pandemic situation. So I'm going to dive right into it. I've pretty much condensed what we talked about in the book into four major categories. The first being just a brief overview and context of COVID-19. Next, I'll dive into artificial intelligence, specifically in COVID-19 screening, research, and treatment, followed by the role of robots in healthcare settings, and of course, future implications where we can go from here. So starting right off with the context of COVID-19, I'm going to take you through a brief timeline of what happened throughout this pandemic, which I'm sure most people would be familiar with already. On December 31st, 2019, that was when Wuhan reported the first initial surge of the sudden unusual pneumonia cases with no clear cause. And that's when they identified the new coronavirus, which immediately spread to the rest of the world and reached Canada on March 9th, 2020. Now, 2 days after that, on March 11th, the World Health Organization officially declared COVID-19 a pandemic. And I'm sure most of us are familiar with that as we were all sent home from university and schools were canceled. And following that, Canada immediately placed new preventative measures, which we are now familiar with in terms of physical distancing, mask wearing, etc., and passed the Emergency Response Act on April 11th. Now, following that, over this period of time, new treatment proposals have been brought up. Although debatable, there was hydroxychloroquine, remdesivir, and a bunch of other drugs currently in clinical trials. And June 18th, this is when Canada reached over 100,000 cases of reported COVID-19 infections. And now, from June until August, we're continuing to go into economic reopening, trying to find a new balance and a new normal within the current pandemic. Now, with that, I'd like to take you back a couple of years to the 2015 Ebola outbreak, and this is when the role of robotics was first assessed in a pandemic situation. Now, in terms of disease management, there were three areas where robots had the most contribution. The first being clinical care, which involves disease prevention, screening and diagnosis, as well as patient care, followed by logistics, which involves the handling and transport of contaminated waste and disinfection of public spaces, and lastly, putting everything together, and with the large data collection of artificial intelligence, we're able to track disease progression, monitor viral transmission from person to person, and follow the epidemiology of the outbreak. So now I'm going to take you through how this model applies to the current 2020 COVID-19 pandemic through the rest of my slides. So I'm beginning with artificial intelligence and the application of AI in the COVID-19 disease progress. Artificial intelligence, just as a brief overview, is essentially a branch of computer science that concerns with building machines that can perform tasks typically requiring human intelligence. So it's exactly as what its name suggests. And in terms of COVID-19 screening, one of the major uses of AI is temperature screening in public spaces. So this allows for mass screening in crowded areas to see who exhibits the symptoms of COVID-19. And this is mostly done through AI-powered smartphone apps, which monitors users' health and can also notify users of infection hotspots where positive COVID-19 cases have been reported. And it also allows us to track the geographical spread of the virus. The picture on the right here shows the iThermal app, which was launched in Singapore, and it's essentially a smartphone fitted with both a thermal and 3D laser cameras to detect the temperature changes in individuals that are walking past. And when someone with a fever is detected, it'll immediately send an alert to local authorities, and then people would be able to track the activity of this feverish individual. And this leads me to talk about contact tracing, which tracks the location of these COVID positive users and warns those who have come in contact with infected individuals. And this is one of the main methods currently that's available for us to keep an eye on the disease progression. And there are two apps that I like to bring your attention to, and both of them involve the use of Bluetooth to conduct contact tracing. So the first one is Trace Together, which was also launched in Singapore, that uses Bluetooth relative signal strength indicators between devices to record the encounters. Now, no location data is collected, but as soon as the user downloads this app, they're also giving permission for the local Ministry of Health to get access to their previous activities in the past 14 days if they do test positive for COVID-19. And once they report that they're positive, the Ministry of Health can then contact everyone else who has been in contact with them. And I'm sure many of us are familiar with the COVID Alert app, which was launched by the government of Canada just I believe 1 month back. And this system exchanges random codes between devices with the app installed, so no personal information is actually leaked. And if you do get tested positive for COVID-19, you self-report this, and this generates a random code. The app then filters through the random code and see which other devices have been in contact with this code. And again, using Bluetooth signals, they determine exposure by seeing who you have been in contact with within 2 meters for over 15 minutes, and that's when an alert would be sent to your device. And now, in terms of COVID-19 research and treatment, machine learning is the specific branch of AI that has been delved deeper into. And machine learning is essentially anything where the code isn't explicitly programmed, but that the artificial intelligence or the machine itself learns from experience and can self-direct through the process. And this is useful to analyze large quantities of data and identify patterns in it to construct public health models. Now, the Chan Zuckerberg BioHub actually does this in order to approximate the number of undetected COVID-19 cases and evaluate the consequences on public health. So what they do is they analyze the viral genome of the coronavirus and identify any mutations and use that information to predict where the undetected cases could be. And another company, Benevolent AI in the UK, actually use it for drug development. So machine learning in this case is used to identify relationships between genes, diseases, and drugs in order to narrow down large quantities of medications to specific effective drug compounds. So one drug that was discovered through this method is called baricitinib, and it's currently in its final stages of clinical trial, but it was initially a drug used for rheumatoid arthritis. So we can see how machine learning can really help when it comes to research. Now that we know about AI, let's take a closer look at how robots actually play a role in the healthcare settings. And I'll be talking specifically about hospitals, long-term care facilities, and even in quarantine. Now, with hospitals, these are only 3 examples of the many roles which robots play, but these are some of the most prominent ones which I will talk a bit more about. The first one being robot-assisted surgery, which I'm sure, again, a lot of us are already familiar with, as it's been a popular procedure because of its minimally invasive qualities. And because it's minimally invasive, it reduces the duration of hospital stay by patients post-operation. And this also limits the amount of time they spend in a high-risk environment such as the hospital, which therefore limits viral transmission. And of course, this limits direct human contact of the surgical staff or the surgeon to the body or to the patient themselves. And it minimizes exposure of surgical staff to bodily fluid. And we know that viral particles can actually pass through these surgical plumes and smoke produced during surgery. So this minimally invasive quality would really limit that. Next is automated disinfection throughout the hospital. So what robots do here is that they can identify high-touch areas, map them out, and then decontaminate the high-touch surfaces with ultraviolet UV rays. And they can also dispose medical waste, which ultimately increases efficiency as they free up hospital staff to conduct other tasks. Now, with the UV disinfection, there's a company based out of Texas that has developed something called light strike robots that use pulsed xenon to create this UV light and disinfect the areas. Now, aside from that, we also do have patient care. So robots can play a direct role in the entire process of patient care, from monitoring vital signs to delivering samples, food, and drink, or even providing entertainment. And for patient care, I'd like to bring you to an example in the next slide. But of course, all three of these lead to reduced exposure and viral transmission. So this is what I want to show you about in terms of patient care. This is a smart field hospital based in Wuhan that was set up in March 2020. It's actually set up in one of their local, I believe it was a field. So yeah, a smart field hospital. And in the hospital, as you can see here, frontline workers worked alongside these robots, and these robots actually took the burden off of them. And they used a team of 12 robots, as well as other IT devices, to treat patients with signs of COVID-19. And when the patients enter the hospital, they're screened with robotic thermometers, and the staff members would be alerted if symptoms are detected. And once they enter, they're actually given a smart bracelet and ring, which syncs with an AI platform. And the staff also wears the same thing, and these devices monitor their vital signs, from blood pressure to temperature to heart rate, and all go to the same platform where the disease spread or the viral spread could be tracked. And on the bottom left, they also have these UV robots that disinfect high-touch surfaces, which I mentioned before. And in quarantine, robots, of course, are used for delivery, whether it's food, medications, groceries. And the company Cloud Minds created a smart transportation robot called the Cloud Jenner that does exactly this. And of course, telemedicine and telehealth, which all clinics are switching to now currently. But of course, robots can also facilitate social interactions and even provide entertainment, which gives them a very important role in long-term care facilities where the elderly residents are distanced from their families and are isolated there. So they can provide assistance to them, but also even facilitate interactive cognitive games to keep them busy, and also provides a mode of communication for them to either call or video chat with family members outside of the facility. And lastly, this brings us to the future implications. Knowing all the roles the robots now play, what are the different advantages and disadvantages in pandemic situations, and where exactly can we go from here? So in terms of advantages and disadvantages, of course, there are a lot on both sides. In the pandemic, the major advantage is using a machine definitely reduces human exposure to the virus, so it'll limit viral transmission. And machines such as robots and AI are very efficient and can even free up frontline workers so that they can do other tasks. This reduces manual labor, and because they're programmed machines, they can also perform routine tasks with little to no errors. And lastly, one of the main benefits of using a shared AI platform is to facilitate large-scale data collection. And through this, we're able to manage to track the epidemiology of the coronavirus and also track the disease progression, see what the best ways there are to contain the disease. Now, of course, with the disadvantages, there are a couple of very big points that most people are concerned about. The first being privacy issues and sharing this data with an AI system. There's always going to be a concern there, even though all the apps are trying their best to limit these issues. Of course, the fear of robots taking over jobs and reducing job prospects when the unemployment rates already rise because of the pandemic. And robots are very difficult to operate in an uncontrolled environment where there are a lot of variables. And of course, that's exactly what a pandemic is. It's very unpredictable. And lastly, there's an insufficient time frame for robots to be fully developed so that they can actually contribute to the COVID-19 pandemic of today. So what does that mean? It means that we should use the information we have from today to facilitate and to plan out for the future, what we can improve for the future and how we can prepare ourselves then. And of course, the disadvantages will always be there. So the question that I will leave with all of you today is that, are these risks really something we're willing to pay? And if yes, how can we actually reap the benefits of robots in such a way that we can also mitigate these risks? And yeah, thank you. That's pretty much all I wanted to share with you today.
I see here that Alyssa asked, does machine learning ever go wrong? And I think that's a good question in regards to especially things like data tracking when we're trying to track the spread and the impact of the virus. Is there a risk, do you think, Maria, for machine learning to, say, pick up the wrong patterns and give us a misinformation when it should be, when it's normally understood to be more accurate and better than humans scrambling to do all this research themselves? What do you think, Maria?
Yeah, for sure. So with any system, it can definitely go wrong. Now, one of the things with machine learning is that it learns based on experience. So from the data that is already analyzed, it can analyze new sets of data. And so this is a problem when it sees a set of data that's never seen before. This could be a problem when it comes to developing new drugs that don't have a lot of prior information, when it comes to analyzing trends and patterns and also their interactions with specific genes. So this is one of the main problems. And also, as what you mentioned before, whether machine learning produces misleading results or it can go in the wrong direction, that's definitely another possibility. Especially when there's selection bias in choosing the data that's inputted into the model and into the system in the first place, and the accuracy of the actual data. So if fake data is put in at the very start, then the entire model would be useless essentially, because it wouldn't produce any valid information. But it's still a good idea to invest in machine learning because it definitely has the potential to be better than real people when it comes to analyze the information that we're not familiar about. So when it comes to new information, especially in the case of a completely novel virus and developing drugs for the virus or tracking data for the virus itself, because we're not familiar with this type of situation, machine learning is something that can pick up on these new things at a rapid pace and grow that way.
Awesome. Thank you very much, Maria. One of the people's concerns seem to be privacy protection. So how is it that with the upsurge of technology and the use of robots that we can protect people's privacy better while increasing and improving upon our technology?
Yeah, so privacy is definitely one of the biggest concerns there is. And I know all of the existing smartphone apps, when it comes to contact tracing, tries to take that into consideration. So for example, with the COVID alert app, which the government of Canada put out, they made sure to not disclose any personal information, and there's no location tracking. So it's only based on sending random codes and matching these different codes and numbers. And this is also why most of the smartphone apps, it's self-disclosure if you are diagnosed with COVID-19, so they don't have access to any of your personal or healthcare information. So that's something they're trying to distance. And I also just noticed here my personal opinion on these issues. In terms of that, I think we just need to be clear, or the companies and organizations that take these data, they have to be transparent about what they want to do with it in the future, whether if they hold on to it or if they don't hold on to it. And if they do hold on to it, what are they planning to do with it?
There is actually just one more question for you, and since we've got 4 minutes left, I'll just toss it out there. Alyssa had also asked, roughly how long is it predicted until robots would be more effective during a pandemic? So if that's confusing to you, we'll have Alyssa expand, but if you do have an answer off the top of your head, you can just go ahead and shoot for it.
Yeah, so I'd say for that, technically they are already effective currently, and there are countries and different companies out there and different hospitals that are currently using robots to perform all of these actions and to help facilitate the pandemic, essentially. The thing is that because the pandemic hit us so suddenly, all of these developments came very rapidly and they just came out of nowhere. So something that would help is to integrate robots into our everyday lives over the next couple of years. Not exactly sure what a specific timeline that would be. It could be anywhere from just next year, this year, or 10 years into the future. But once they're actually fully integrated into our everyday lives, I feel like the transition would be a lot smoother if we are hit with another pandemic in the future. And yeah, that would definitely help.